This is just the beginning.
Welcome to this annual Giving Tuesday event, an event we've hosted for 4 years on this important day of giving during this year of extreme need. Our virtual event today is on COVID-19 and the fight against AIDS. I'm Nyla Boodoo, host of the Axios Today podcast, and I'm coming to you from my home in Washington, D.C. Thanks to Bank of America for making these conversations possible, and welcome to all of our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can follow along using the Axios Events hashtag, and you can also follow Axios on Twitter. Over the next 45 minutes, we're going to be unpacking how to manage the simultaneous public health crises, distribute essential care, and how maintaining philanthropic efforts are happening during this pandemic. Our first guest is the founder of Every Mother Counts, Christy Turlington Burns. It's been a decade since she started the nonprofit. Its goal is to provide every woman with access to quality, respectful, and equitable maternal care, which was already a problem in this country prior to the pandemic. And now the nonprofit is grappling with how to reach these main goals while dealing with the effects of COVID-19 on pregnant mothers. Hi, Christy, welcome. Thank you for making the time to speak with us today.
Hi, thank you. It's great to be here.
So, Christy, as I said, we're really facing two pandemics, not just COVID, but a crisis when it comes to maternal health. And I think many people might think problems like maternal mortality rates are something that happens outside the U.S. But you and I know that's not true here, especially when we think about Black and Indigenous mothers. And I'm wondering what you're seeing, how the pandemic has made all of this worse.
I think you're very right to point out that Black and brown women have been disproportionately impacted for many, many years before COVID with maternal health outcomes. In the United States, for example, a Black woman is 3 to 4 times more likely to die from a pregnancy or childbirth-related complication, and an Indigenous woman is approximately 2 times at greater risk than a Caucasian woman. And that's just completely unfair and unjust. It's something that we've been focused on for the past 10 years, and even prior to that, before I started the organization. But in this period of time, we've really been focusing on the disparity aspect, really using this crisis in a way to help elevate an issue that I think touches so many of us, but not enough of us know about, of course, until it's too late. I experienced a postpartum complication when I delivered my daughter, which is what sort of illuminated this issue on a global scale. And of course, the more that I dug in, the more that I learned how poorly the United States was doing. We are currently ranked 55th in the world, according to the WHO, and we have slipped farther and farther behind in the past decade. We are one of only 2 countries with a rising maternal mortality rate. So, of course, that has been top of mind for the organization and for me personally. But I think right now what we're seeing is this opportunity to really work around this elevated, I would say, focus on health disparities through COVID, as well as health systems and infrastructure, which is so important and so needed to deal with any health-related issues.
So when we're talking about infrastructure, I know that you have been part of New York's maternal health COVID task force. And one of the recommendations that you all made was that maternity care can be safely moved outside of hospitals during the pandemic. And I wonder, how hard was it, for example, to create a freestanding birth center in Manhattan? And I assume we're only talking about for low-risk births here.
Of course, low-risk births, which most births are. But yes, we joined the task force after seeing really early days where Governor Cuomo was having to be very creative around how to manage hospitals as we were the epicenter of the crisis in those early months. I think that he has been on board around maternal health issues in the state for some time. We have been working closely with his office on various things such as doula reimbursement through Medicaid and other issues. New York City had birth centers up until about 2 years ago when our last Manhattan birth center closed. It's the birth center where I delivered my 2 children. And so it's been something that we've been really focused on trying to examine and try to bring more energy to, because there is certainly demand. But I would say early days of COVID, where you saw in every newspaper and on every news channel that there were women and families who were really, really frightened to go to the hospital to deliver their babies. Policies were all over the place. Information was really lacking. And it's not the ideal scenario to be bringing life into the world. So one of the things, once we reached out to the governor's office and his team, Melissa DeRosa, who led the task force, she pulled together a number of stakeholders to really be able to focus on sort of broadening the definition of safe delivery sites. Auxiliary maternity care units is what the words were used to describe what we were trying to do, to really not only to put a birth center up in a central location in Manhattan where there was a huge need, but also to help expand the awareness about birth centers as a safe option for pregnant women at any time. We saw an opportunity with the talk about having a second surge or potentially a third after that. And so when the task force came together, it was really an ideal period of time to sort of take in what we'd learned and prepare ourselves for what was coming. One of the other recommendations that we made was really to help to support community-based doulas. Immediately those members of communities who really serve the populations who are at highest risk, they were shut off from their patients. And so the quick move to telemedicine, virtual support was really imperative to make sure that women and families who normally fall through the cracks would not fall through the cracks during these months. So we were also able to launch a website, Just Birth Space, which is there and free for women and childbearing families to access information, to understand how to navigate which hospital systems in the New York and New Jersey area. So just to set ourselves up in a place so that people had access to information all the way through. It's critical.
Do you feel like this time around, as we're looking at possibly a surge within a surge, do you feel like there's better policies in place right now for pregnant women? Do you feel like it's clearer? Do you feel like women know where to go and they have places to go?
I think that the advances that have been made around testing certainly is going to make an impact. People feel safer with that information and knowledge and access. I would say also in those early days, as you recall, PPE was just not available. So we've done a lot of work around making sure that health workers and families had access to adequate PPE. So I think those are two concerns that are not as frightening prospect as they were in the first surge. However, policies are changing constantly as information is coming in every day. And I think it's really important for people to understand, like, if they are pregnant, where they will be delivering their child or what their childbirth options are, and to really understand the policies in place, and to stay on and to stay connected to their healthcare provider so that if any changes should arise, that they are fully aware. I think we are in a better position. I think it's like any kind of disaster relief or emergency situation. When it's all hands on deck in those early times, you really learn a lot. And at this point, I feel that more people are prepared with what the policies might be. They have access to information and resources. And at least at this point in time, I think most hospitals have been allowing either a birth companion or a partner or spouse in the room with you. And that may change. It's just really important to be really tightly connected to our providers at this time.
Mm-hmm. When we're just thinking about the whole idea of labor, right? Like you mentioned doulas. I know licensing for midwives and doulas is something that varies widely by state, and there's often really fierce opposition from hospitals and doctors' associations to this. Do you feel like this pandemic has changed that?
You're right, and that's actually another recommendation that that New York State took on, which was just being a slightly more open to licensed midwives. Midwives and doulas play a huge part in maternity care, and there are not enough of them, and there are not enough. There's not enough support for them. I mentioned reimbursement of Medicaid earlier. There are very few states in the country that adequately support these types of health care workers who we know make a huge difference in the impact of childbirth for any woman, let alone a woman who may have a chronic health condition or be marginalized. I think that's the way we've looked at this opportunity, really, is a way to put forth evidence-based models of care that are proven, that make an impact, and to make sure that they are in place now, but that they are in place for well beyond this period of time that we're all living through right now. It's something we've been very focused on as an organization to increase not only demand, but also to educate the public about the quality of care that midwives can provide, that community-based doulas can provide, and that we really look at maternity care as an ecosystem, right? There are many, many roles that are within that system, the people who take care of women's health. And so, as you mentioned earlier, the idea of a birth center being a great option for a low-risk birth, many births are low risk, of course, until they're not. And so really creating the infrastructure and the options for women to be able to have the quality of care that they need, and also the linkage to that higher level of care should they need it. It was really imperative when we helped to put the Jazz Birth Center up over the summer that there would be a receiving hospital for that birth center, and that there be a relationship and a linkage to that care because things happen, people get transferred, things can happen in a moment's notice. And so really thinking through all those possible outcomes is critical, which is why the health system piece is so important.
Christy, we're almost out of time, but I just wanted to ask you one last quick question. It's also World AIDS Day, and the roots of your activism were actually in Red and One. And I just wanted to end by asking, what was it about that experience that maybe inspired you to take such an active role in maternal health?
Yeah, I've spent so much of my life and career traveling around the world, being exposed to people and cultures and communities that were different than my own. And I had some great experiences traveling with Red and One early days before becoming a mother, and then very shortly thereafter. And of course, once I became a mother, I couldn't help but look at the world through a mother's eyes. Learning so much about HIV/AIDS and the prevention of the transmission from mother to child. It was so eye-opening in those early days, seeing how far we had come since the 80s when AIDS first presented itself in the world, and then seeing the resources being dedicated towards HIV, to antiretrovirals, just really the systems approach and the way that resources were really being sort of directed and channeled. I think that sort of showed me how critical it was to have that infrastructure. I think by the time that I started advocating on maternal mortality and morbidity, there was this sense that we've learned so much through the HIV work that we can sort of build on that progress made, and we can start to help make those health systems more welcoming and more comprehensive, so that when a mother came in, you could address many of her health needs, not just a narrow lens. And I think that's still something that's needed. Unfortunately, in more recent years, some of those funds have not been directed, or are not not the commitments have not been as secure as we would like them to be. And I think that it's clear that people will struggle as a result of not having access to the medications that we know are proven and work. So it's really important to take this day and every day really to continue to move forward, to not move backward, to make sure that we're thinking about the entire population, not just the people who have access to quality care.
Yeah, to your point, how much this pandemic has exposed all of those disparities. Christy Turlington Burns is the founder of Every Mother Counts. Christy, thanks for taking time to speak with us on this Giving Tuesday.
Thank you so much.
And now let's hear a word from our sponsor at Bank of America.
Ultimate Health Services Corporation is a non-for-profit community health center. It was started by a group of community activists out of the East LA riots that were part of the civil rights movement back in 1969. We serve around 350,000 patients on an annual basis. We provide primary health care for people who are uninsured or underinsured, both Latino and other ethnic minorities, multicultural communities in the Southern California area. When the coronavirus hit us, we went from about 3,600 visits a day to zero. People just stopped coming. We needed to learn how to provide care in an environment where people will feel safe. We started by creating drive-through clinics. About 10% of all tests in the county of LA are being done through Ultimate Health Services Corporation. We see every day lines and lines of cars that wrap around the block. We're California, what can I say? We do everything in our cars. We also have now the ability to give them their results via phone. We are just humbled by what we have seen, not just our employees stand up and do, but our patients themselves, being able to get themselves to these testing sites, being able to use technology that they have never used before. We are able to move a lot more information faster than we knew that we could do. Once you have better outcomes, once you have people healthy, you then can do anything, because we could reopen our economy, and we are just thrilled to be able to respond this way to our community.
Hi, I'm Caitlin Owens, a healthcare reporter at Axios and author of Axios Vitals, our daily healthcare newsletter. Joining me now from Lusaka, Zambia, is the head of Advocacy, Planning and Development of Churches Health Association of Zambia, Siame. Welcome, Yoram.
Thank you very much.
So, just to get started, why don't you tell us a little bit about what your organization did pre-COVID, especially in the realm of public health?
Thank you. So CHAS is a collection of health facilities which are owned and run by the church. And before COVID-19, we were very much involved in health system strengthening and prevention of diseases. We were primarily engaged in HIV, TB, and malaria. And in this regard, we were involved in HIV prevention efforts, in malaria prevention efforts. With regards to HIV, we are focused on putting people on lifelong treatment in order to improve their quality of life. And in this regard, we were also involved in ensuring that people adhere to treatment. As you know, treatment is a critical factor in preventing the further spread of HIV and keeping people alive.
Great. And I'm sure the pandemic has disrupted those efforts in some ways, but before we get into that, can you just talk about how the COVID-19 pandemic has impacted Zambia, both health-wise and economically?
I'll start with economically. As you know, Zambia is a landlocked country, which means that we depend on our neighbors for most of the goods and services. And when those countries go into lockdown, it means that our supply chain is cut off. And this has got a big impact on economic activity, because the manufacturing base for our country is in some areas is still growing, And so we are not able to produce what we need. So that's the first thing. The second thing is that this lack of access, because we are landlocked, affected many sectors of our country. And economically, the shutdown, at some point we had a partial shutdown, meant that people had to work from home. Not everyone can work from home, and not everyone has job security, so this resulted in job losses. Businesses made losses, and that had a big economic impact. With regards to healthcare, once again, there is a link. The first one being our health systems were impacted because, once our neighbors and other countries through which we depend on to receive drugs and other medical supplies go on lockdown, then it means that our health systems will also be impacted. The second thing we saw is that once health facilities are looked at as a place where you don't just seek health services, but where you might get COVID-19, people begin to fear it is because now the symbolism of health facilities change from a place where you seek health services to a place where potentially you can get COVID-19. So the big push had to be how to do several things. First of all, how are we going to ensure services are provided in a way that people coming to seek health services do not acquire COVID from the health facilities. Added to that, how do you make sure that the people providing the services are also kept safe? How do you ensure that our testing capacities are ramped up to ensure that we are able to provide tests, reliable tests, timely tests, to make decisions related to COVID? And last but not least, how do you provide services in those instances where some of your health facilities have to make way for wings, where it becomes a COVID wing, so you readjust the health services. How do you adjust in this new normal? So those were some of the impacts on our health systems. We had to repurpose some of our testing capacities. We had to repurpose some of our human resource. We are living in an environment where we don't have the number of health workers that we would need. COVID-19 meant that this little human resource had to be shared between other issues like HIV, TB, and malaria, and non-communicable diseases like cancer, which are not going away. And then you have got something new. So you have to stretch the little resource you have, whether it be human, financial, infrastructure, and otherwise, to attend to this emerging issue.
Right. And can you talk about what the impact of stretching those resources has been, especially on your efforts to fight the HIV epidemic?
So it has been very difficult because COVID brought about new dynamics. One of the biggest enablers of a successful treatment program is that people are supposed to be on nutrition. And as you know, nutrition relies heavily on livelihoods. So once you shut down livelihoods, there is a big risk that people will default on treatment. And that was one of the biggest issues. How do we ensure that people on treatment are supported with resources to ensure that they continue taking their drugs because they are supported nutritionally? And you have to remember that you're trying to do this in the midst of an economic challenge caused by COVID. So that is one of the issues we had to adjust. The second thing we had to adjust was we had to look at the envelope we had and take out some of the issues. So we had emerging issues like the need for personal protective equipment for health workers. And we also had to ramp up a massive campaign to educate people on what COVID is, how you get it, and all those facts, and how to ensure that they remained COVID-free. And that was a big challenge. And to a large extent, it continues being a challenge.
Right. And I mean, maybe I'm being overly optimistic here, but I do wonder, since you already had so many resources put into public health, and not just public health, but infectious disease, and since your populations have already been so kind of trained to in the language and what you're supposed to do amid public health dangers, do you think any of this helped prepare you for the COVID epidemic better than the United States was in some ways?
Well, not really. If you look at this, it's very much in its, if it's not in its infancy, then it's definitely before its teenage years. It is still developing. And that is why before COVID came, there was a lot of investment in health system strengthening. Literally speaking, there is no aspect of our healthcare system which doesn't need strengthening, be it supply chains, human resource for health, infrastructure, medicines, research capability, HMIs. All our systems are developing. So when you have a crisis like the COVID hit you at a time where you are still developing this system, is way, way worse than what you would expect. We have been fortunate so far because we don't have the numbers of people dying like in the US. But this is not a comfort. And the reason it's not a comfort is that we have seen COVID-19 evolve in unpredictable ways. So one part of the world today where it's slow becomes tomorrow's hub where creation happens. So the question still on our table is how do we ensure that we do not become tomorrow's hub? Because regardless of where the infection is going to reside and incubate, eventually it will get to the rest of the world. And as we are speaking right now, we need huge investments. Red has supported Zambia, and some of the resources which we are using right now, we were allowed to repurpose it. So some of the money we could use in buying PPE, we could ramp up COVID testing, even buying machine and equipment which we could use to test. We could use some of the communication money to educate people on the new and emerging issue of COVID-19. So when you look at all these things, it's thanks to the flexibilities which we need to have. But you cannot do these flexibilities without continued investment. Resources are still needed.
And we like to wrap up with these conversations with one fun thing, just something a little bit lighter, positive note. So can you just tell us, I think most of our viewers live in America, maybe not, but can you tell us what is your version of social distancing? What have you done for fun to keep yourself sane while also staying safe?
Well, that's quite difficult. For social distancing, we've had to embrace new technologies, working from home where people can. So it's been a learning curve because we are far ahead of us in terms of social media. So we're still catching up.
Well, maybe not as much social media might be a good thing. Here, I think social media causes a lot of anxiety these days. So, anyways. Yoram, thank you so much for joining us today. This was a really informative conversation. And I hope for your sake that you do not become tomorrow's hub. Thank you for everyone watching. Yes. And now we have another video from our sponsor.
Happy birthday to you. Happy birthday, dear Lulu.
My name is Luana. That's my mom. We come from Zambia. We're on a big trip together.
We are celebrating my daughter's birthday. She's one child who is just too anxious to grow up. She would say, "How old am I today?" And then if you tell her that you're still 4, she said, "I'm still 4, but when am I turning 5?
1, 2, 3, 4, 5. I am 5 years old today.
I've had other children before, and I lost them to HIV. And I waited for a long time, and then I decided to try once more because now there was treatment. She's very special to me. To be a mother to a child who has never been sick, who is a healthy child, I can't even put it in words. Never in my life did I think that I would live a life of happiness. She has never seen snow. She knows what happened in my past.
One day I want to be a doctor so I can help other people when they're sick. That's my wish.
Thank you to Bank of America for making these conversations possible. I'm Mike Allen, a co-founder of Axios, coming to you actually from Axios HQ in Arlington, Virginia. I've only been here a couple times. Since March, our next guest is Gayle Smith, President and CEO of the One Campaign, which is working to end extreme poverty around the globe by 2030. Gayle's lived in Africa for 20 years, worked on the National Security Councils of both President Clinton and President Obama, and most recently was the administrator of USAID, where she had 10,000 people under her. Gayle Smith, welcome to Axios.
Thank you so much for having me, Mike.
So Gayle, thank you for joining us from your dining room there in DC. And the One Campaign is known for ambitious goals. And a few years ago, the One Campaign asked about the US AIDS response: red ribbon or white flag? Where are we at?
It's a really great question. I think we are at a moment now where we've got a red ribbon. In other words, we've made enormous progress across multiple administrations and all over the world in the fight against AIDS, really, really reducing the numbers, more people on treatment. The white flag that we're looking at right now is the risk of HIV and AIDS being crowded out by the pandemic we're living through now, and the world losing its attention to the HIV/AIDS epidemic as we focus on yet another virus.
And Gayle, you have a partner organization, RED. Tell us about the work of RED.
So RED is really cool. RED was started in 2006 by Bono and Bobby Schreiber. And the idea was, how do you get companies into the fight, right? The world's put billions of dollars into the fight against global AIDS, but we need to keep the money flowing so we can actually end the epidemic. The idea was simple. The companies could dedicate either their products or their services to turning red. So you imagine a red phone. There's an iconic red t-shirt. Bank of America turns ATMs red and has made a huge commitment. Those resources go to the Global Fund for AIDS, TB, and malaria. And since 2006, that's meant $650 million, impacting 180 million lives, not because people actually gave money, it's because they bought products or used services that had turned red and that those businesses had agreed to allocate that money to the Global Fund.
So it makes it more real to them, obviously adds visibility.
Yep, it adds to visibility. You know, Bono always says red is the heat, the color of the heat of an emergency. And again, it's a way for people to support the fight against AIDS, but also for businesses to do their share. So just to give you an indication, RED's made a commitment now to another $150 million, which means of the 75 donors around the world, so the Global Fund, RED is number 14. So it's a big player, because I think Bono and Bobby had a great idea in the beginning of how do you enlist businesses in the fight.
Now, Gayle, as we were miking up and futzing with our lights, as my mother would say, we were talking about the fact that AIDS response for the US government is the rare bipartisan issue. And you even said something nice about the current administration.
Well, here's what's interesting is that the big push for the United States and for the world, in fact, was from President George Bush, who launched something called the President's Emergency Program for AIDS Relief. The Obama administration came in and did not do what sometimes happens, which you get rid of the initiatives of the former team, but built on that and committed literally billions more dollars. During this administration, actually what we've been able to do is work with Democrats and Republicans on the Hill to make sure that the president's budget continued to include robust funding for the fight against AIDS. And I will tell you, at a time of, you may have heard this, there's a fair amount of division floating around Washington, to know that there is at least one issue that ending this epidemic that we know how to end and where we've made so much progress is still a priority and still a place where, again, Democrats and Republicans have shown that they can work together is encouraging. I'll take it.
Gayle, you mentioned the mind share that inevitably goes and properly goes to the pandemic. Now, I saw you tweeted the other day, this is a global pandemic, needs a global response. What happened?
We're not there yet. And I think it's no secret that the world is more fragmented and divided now than it's been for a long time. And one of the victims of that has been the kind of multilateral cooperation that led to, for example, a robust international response to the Ebola epidemic or to the HIV/AIDS epidemic. We haven't seen that. And while we understand countries obviously have to focus first and foremost on how this pandemic is affecting them, the world also needs to look outward and realize that this is global. I mean, if you think about the impact on the world's poorest countries, it's not just the virus. It's the same economic shock that we're seeing elsewhere, but they've got less to fall back on. We've seen the disruption of 80% of the global fund's HIV and AIDS programs. Those are going to translate into losses for people and for economies over time. So we really need to band together. We are much more effective when we do that to defeat this virus, just as we fought others.
Now, Gayle, when we first met and when I first started covering the One campaign, 2030 seemed like a long way away. It suddenly feels sooner.
It's getting close. And look, it's an ambitious target to say 2030. Part of that is tied to the end date for the Sustainable Development Goals, which the entire world agreed to some years ago, but on which the world hasn't made the progress it needs to. But look, here are the facts, Mike. If you look at the last 20 years, there have been huge gains in the fight against extreme poverty. In fact, one of the tragic realities of today is that with this pandemic, we're seeing the first increase in extreme poverty in over 20 years. And we can arrest that and continue on the trajectory. It's a question of whether we're going to marshal the political will, the enlightened self-interest, and the resources we need to do it.
Because extreme poverty has had encouraging metrics. It's been a rare global success story.
It's been extraordinary. If you look at extreme poverty, if you look at health and the gains that have been made in things like maternal mortality and how long kids are living and the fight against AIDS, TB, malaria, huge progress. We know how to do it. The world's joined together to do it. And we're at risk of losing a lot of that progress if we don't bear in mind and act on that collective action that's gotten us this far.
Gayle, I mentioned at the top your formidable national security credentials, and so many people around town know you from working with you on national security issues. What are the early signs to you of the incoming Biden administration? What do you think of the cabinet that he's building, and what do you think of the approach and emphasis so far?
Well, look, I think it's a good team. I've had the honor and pleasure of working with a lot of those people for many, many years, and they know their issues. They're also deep believers in public service. In other words, you do this because it's not about me, it's about public service. And I think that makes a huge difference. I think that one of the things that the president-elect talked about a lot during the campaign, which will translate both at home and abroad, is this notion of dignity and fundamental respect. I mean, we've been looking at fragmentation, at the world at odds with itself, at countries competing with each other in areas where historically in the future, again, if we join forces, we can get a lot done and make the world a lot fairer. And I think that's a demand that is coming from every corner. So we are hopeful that this is going to be an administration that is about returning to multilateralism. I worked with the president-elect when he was vice president. He knows development. He understands it. He's been a big supporter of it. He gets it. So we are hopeful that we'll see some real progress.
Yeah, Gayle, you know the president-elect well. Based on your personal knowledge of him, watching him work, whether it's a room or whether it's a country, what is your forecast for us, or what insight can you give into us into how he is going to approach global engagement?
Look, you got to remember he spent many years as the chair of the Senate Foreign Relations Committee. He's been around the world a lot. He knows the world well. He knows a lot of people around the world. So he's a known quantity. I think that provides a great advantage. But I think there's a depth of understanding from the heights of some of the national security or global economic imperatives to the realities of people's everyday lives and how those everyday lives affect those other two things. I think he's just got the experience to get that. And he's also, he's a really human being. I mean, he's a very real, empathetic person. I always found in very the time I've been able to work with him.
Very Joe, right?
He's very Joe. He's real, and I think he genuinely believes that the best way to get things done is to try to bring people together. And I hope that he's able to do that.
Gayle, this event is on Giving Tuesday, and as we think about Giving Tuesday and global AIDS response, I wonder if you could talk a little bit about the importance, in your view, of corporate sponsorships and partnerships.
I think it's really important. And I think it's, I don't think of it as charity as much as I think of it as both solidarity and responsibility. Look, we all live on this planet together. As we've seen, we are all affected, if not unequally, but by this pandemic. And I think that when, as we've seen with RED, for example, when the private sector forges a partnership, it results in real benefits for people's lives. So whether it's the Bank of America translating that into 35 million, whether it is all the companies that have products now online, which you can buy, you can shop RED. It just went up on November 18th. There's a shop-a-thon. It's on TikTok. It's on Snapchat. It's a way to send the message to everybody that everybody's got to be in the fight. And if we're going to get the scale and the impact we need, nobody can stand on the sidelines.
Gayle, I'm getting the hook. So a quick penultimate question. So it's a very quick answer here. I mentioned your 20 years in Africa. That includes as a war correspondent. We have to get a quick war story from the war correspondent. How did that experience change you in a way that affects how you lead today?
I covered a war two wars, in fact, in the middle of the famine in Ethiopia in 1984 and 1985, where probably 1 million people died that the world could have reached if it wasn't for politics and conflict. And saw things that changed my life dramatically. The inequity between people struggling to survive and people thriving drove home to me the world's not fair, and my job is to make it more fair.
And Gayle, to end on a lighter note, a human note, we always end our newsletters with one smile to go, one fun thing. In shutdown, you've been creating something new.
Oh, it's like, okay, so I'm sort of losing my mind like many other people. And one option during shutdown is to watch Netflix and eat for now 9 months, which is a bad idea. So I've been making these pillows. I'm calling them pandemic pillows. The longer this goes on, the more pillows there are.
Can you show us one? Can you read one?
Sure. This isn't stretched yet. But see, here's what they look like.
Oh my goodness. Oh, that's amazing. Oh, fascinating.
It's amazing. And I say, Mike, this is going on long enough that you shall probably receive one.
God bless. Well, Gayle Smith, thank you for your important work. Thank you for great conversation. Thank you for joining Axios.
Thank you so much for having me. Take care.
We thank Bank of America for making these conversations possible on this harmonic convergence of Giving Tuesday and World AIDS Day. I'd love for you to join me in hitting the red.org donation page. It's very easy to red.org/donate-Bank of America. red.org/donate-Bank of America. I'm joined now for our Why It Matters segment by Nala Budu, who's the host of the Axios Today podcast. And Nala, I was really interested in your conversation with Christy Turlington Burns about the point she was making about disparities that are ever more obvious.
I think what I took away from that conversation is we are in a moment where there's so much attention being paid to health disparities because of the pandemic. And it's interesting to me to see organizations like hers that are using that to reach their objective of trying to reduce the maternal mortality rate, which when you think about it, it's sort of this horrific statistic that every 2 minutes, a woman in the world dies because of pregnancy or complications from childbirth. So what she's doing, particularly if you look at like New York State and trying to have freestanding birthing centers, trying to get midwives and doulas, which has always been sort of a contentious thing to get them licensed, but to work on that aspect of maternal mortality is such an interesting thing that she's using this moment to try to help that during the pandemic.
And now, when you and I were chatting off camera, you made a point that Gayle Smith from the One campaign made with me, and that is we really have two pandemics here, right? And it seems like we only have mind share for one at most.
And I was just thinking back to last World AIDS Day and the coverage that I did and how all of those conversations were around how close we were to eradicating AIDS and having a cure. And it strikes me that a year later, we're in such a different place. And there is a concern when you think about the fact that that is also going on, that people are not really thinking about that.
And Nala, you were telling me that in this moment, like you feel a personal tug on these big issues.
I think so. I mean, I think that it's really easy to, Mike, you and I are gainfully employed. We are basically home most of the time, just working. And I think it's really easy to sort of be in that bubble if you are one of those people and not think about the fact that this holiday season is going to be incredibly difficult for people when we're thinking about problems with hunger. The holiday season is when I think we always think about that, but I am thinking so much about the people who have lost relatives, lost jobs, and how difficult a December this really is going to be for this country. Probably one we haven't seen in a very long time.
Now, I thank you for making that point to us, and we thank Bank of America for making these sobering but illuminating conversations possible. I'd love for you to join me on the red.org donation page. It's super easy, red.org/donate-Bank of America. red.org/donate-Bank of America. Now, Budu, thank you for your coverage and for these conversations today. We thank Bank of America for bringing all of this together. I wish each of you peace in this holiday season, and I'll see you on Axios.com.